I've cured 37 parvo cases doing the protocols I'm going to show you right now. I'm going to get right into it. This is really important. Every second counts. The number one thing, metronidazole. This is the number one thing that I use. Metronidazole you can get at your local feed store. You do not have to have a prescription for this. If you don't live close to your feed store, it's worth calling ahead of time just to make sure they have this in stock. Just as important as metronidazole is your fluids. The reason that dogs, puppies will die from parvo is because the parvovirus will eat the good bacteria in the small intestine, which the small intestine allows for absorption of fluids and nutrients. And so when that's gone, they can't absorb anything. And it just goes right through them, which means they suffer and they die of dehydration. You have to get fluids in the dog. Number one. That's literally just as important as the metronidazole. They go hand in hand. It won't most likely work if you do one without the other. Now, if you don't have access to sub-Q fluids like this, you're gonna have to do syringe feeding. And you can syringe feed water, but you also would want to incorporate a Pedialyte or a Gatorade. Some feed stores will sell sub-Q fluids. I've always purchased mine from my vet. If you have a primary vet, call your vet and say, I need subcutaneous fluids. Can I buy them from you? It's not always super inexpensive, but this is cheaper than hospitalizing the dog. And so if you can get sub-Q fluids from your vet, you're probably looking at between $30 and $60 for a bag. Okay, stick with me because I got a lot more things that you can add to this. There are some cases that are really bad and you're gonna have to do a lot, but it's totally doable. The other part to this is there might be things that you don't have access to. You have got to get creative, you've got to get resourceful. If you don't have access to a vet that can give you these, you got to post this shit online. You post it on your Facebook, on your Instagram, on your TikTok. If you don't have any of those, make one. All you have to do is say, I am desperate. I am trying to save my dog from parvo. Can anybody get subcutaneous fluids? Put it out there. I will beg, borrow, and cry on camera if I have to get sub-Q fluids. That is so vitally important to the survival of your dog. But if you cannot do that, you've got to get one of these little syringes. You can get these on Amazon, you can get them at Walgreens, and you have to syringe every couple of hours, Pedialyte or Gatorade. I'm not gonna go over in this video how to administer sub-Q fluids. It's very simple. You do have to insert a needle into the nape of their neck. If you're queasy about that stuff, this is a perfect time to get over it because it is literally do or die. If you don't know how to do this, all you have to do is search in YouTube how to administer sub-Q fluids in a dog. You'll see a plethora of videos pop up. A lot of folks that make these parvo videos swear by these two things. I have added both of these as supplements. I've never relied on them solely just to cure my dogs, but they are a great addition. But one of the reasons for this digestive care, one of the main ingredients is colloidal silver. If you don't know about that, research it. It's like a miracle. I'm trying to get through this as fast as possible. At the end of this video, I'll leave you with what my schedule looks like, the time frame, and when I administer the different things that I'm going to tell you in this video. Again, every case is very different. These are the things that have worked for me. Next up, we got to treat the nausea. We can't have the animal to continue vomiting. We've got to stop the vomiting. Serenia is the number one go-to. I get this from my vet. Now we're going off if you can't get to a vet for some reason. So if you cannot get your hands on Serenia, the next best thing to Serenia is something called famotidine. It's over the counter. You can get it at your local drugstore, a Walgreens. I don't have any on hand. Something similar is Pepcid. Now look, I want to make sure you know, you can go to your vet and request all of these items. You can call your vet and say, hey, my dog has been exposed to parvo. I am positive that that's what's going on. I need an appointment. I cannot afford to hospitalize, but I can afford to get the treatment and treat from home. A lot of vets aren't going to be against that because parvo is so fucking contagious and it is so difficult to get rid of. They don't necessarily want a lot of parvo dogs coming into their clinic. It just makes more work for them. Not that they're not gonna take them, and my vet is wonderful, but I don't even wanna bring parvo dogs to my vet because it's very contagious and it can contaminate a lot of things. Remember, this is your responsibility to take care of this animal. Be bold. You're not gonna offend anyone by wanting the best care and wanting to make it happen quickly. So far, we've got our metronidazole, which is an antibiotic for the tummy. We've got our anti-nausea. We've got our fluids, again, sub-Q fluids. I cannot press that hard enough. If you are on social media, you can tag my social media account, Hand Over Rover, and I will share your post. Someone will have sub-Q fluids if you need them. And then the next thing up is we got to get that dog to eat. Now, not necessarily right off the bat because they feel like a piece of shit, depending on how far into the parvovirus your dog is. But we got to get them to eat. So one of the things you can use is an appetite stimulus. Again, this is something I get from my vet. It's called Entice. This works really, really well to help encourage that appetite for them to want to eat. If you can't get that, you're gonna have to start to force feed. And sometimes even with Entice, you might not get the dog to get an appetite. One of the last cases, I didn't think she was gonna make it. It was really, really tough. And even with the Entice, I still couldn't get her to eat. This is something that I can get off Amazon. It's called ReadyCal. Some vets do carry this and you can buy it off them. And so you can take and you squeeze a little bit out and you can stick it on the roof of their mouth, like up in their gums, somewhere so that they're not just gonna try and spit it out. Because it is sticky and it's thick, it'll absorb into their mouth and get into their system. Little Logan, my most recent parvo puppy, I mixed this paste, this malt syrup, the Under the Weather, and I'll link all this stuff at the end of the video. I mixed this with a little bit of wet food and whipped it up and put it in the syringe, and I just started force feeding her. And so when I say force feeding, keep in mind, you aren't sticking this in their throat and jamming it in. They will aspirate. You will give them, it's called aspiration pneumonia, which means that this doesn't actually go the way it's supposed to and it gets in their lungs and now they're gonna die from pneumonia. All you're gonna do is put this right behind their teeth and just slowly get a little bit in there. Usually they'll start to, smack their lips and then they'll swallow. Even if they don't wanna swallow, they have to swallow. A little tiny bit at a time. There are some cases where the puppy's immune system is so weak or so underdeveloped that sub-Q fluids aren't gonna be enough. They need intravenous. They need intravenous care. And those are situations where you have got to ask for help. If that is you, you have got to ask for help. And it is embarrassing, it's humiliating, it sucks to think like you got yourself into this situation and it's your own pet, but you don't have the finances to get through it, or you didn't get them vaccinated or whatever. By the way, dogs with vaccinations can still get parvo. It's not quite as intense, but they definitely still get it. I get it all the time. I get dogs with it all the time, vaccinated dogs. So with that being said, you have got to get on social media and ask for help. And this is what that looks like. You have to be as honest as humanly possible. Be vulnerable and let the criticism, let the people that are gonna talk shit, let them come. All that's gonna do is boost that post. The algorithm is gonna see it as people engaging with it. More eyeballs are gonna get on it. That is gonna work to your advantage. Don't worry about people that are gonna say shit about it. Just look for the ones that will help, because I promise you, if I see it, I'm gonna help in whatever way that is. I know what this is like. This fucking sucks. I know how hard this is. It's emotionally gonna wreck you, and you don't even know if the animal's gonna survive. You make a post with footage, with pictures, and in the very beginning of that post, you say to your audience, you speak to them like you've talked to them your whole life. You don't have to act like this is the first time you've done it. All you have to do is say, you guys, I've got myself in a situation and I'm begging for help to save my dog. Start with that. My pet Rover has parvo and we're not sure if he's gonna make it. He has to be hospitalized. It's further advanced than what I can do for home care. This is what we're looking at. Is there anybody that could help me out? Remember, when people are going through social media, you've got half a second to get their attention. So you can say right away, my puppy might die, can you help me? ... and then go into it. Okay, the last couple of things. Once you can start getting some of that food into your puppy's system, into your dog's system, you wanna add a probiotic. Remember, all that bacteria has been going away. You wanna add a probiotic. This is one that I have on hand. I don't necessarily know that this is the best go-to, but I take and I'll sprinkle a little bit of this into their food, into their syringe if I'm feeding them that way. If they're starting to eat on their own, I just sprinkle a tiny bit. You don't need a lot, a tiny bit. And then another option is something called Carafate. If your dog seems to be doing better or they're acting like they're hungry but they just can't do it, it's because their tummy is just so damn raw. They want food, but they can't do it because it just hurts so much. And so this is something called Carafate, and it actually looks like a little Pepto-Bismol when you get it in the syringe. It's a little pink pill, and you put it in one of these, you put a little bit of water in there, you swish it around until it's just liquefied, and then you administer the same way. I don't know an over-the-counter option for this. You don't necessarily have to have this. If it causes vomiting, if your dog throws it back up, get rid of it. We don't want any more vomiting. You don't need this, or at least you don't need this yet. For stuff like metronidazole, I've had vets give me the liquid form of this, and I will not use the liquid form of metronidazole. I don't find it to be as strong. I have not had great success with it, and I have stopped liquid in the middle of treatment and gone straight to the tablet form. I've even taken the tablet, crushed it up, put it in a little water when I had a dog that couldn't keep anything down, and just syringe fed it to them. I don't know what the difference is. I don't know why that, if maybe that was just circumstantial to me, but I have not had great success with the liquid form of metronidazole. The other thing are pill pockets. If you don't use pill pockets, these are so good because of the texture and how they kind of slip. They can slip right down your dog's throat. So you put a little pill in there and then you just use your thumb to pop it back all the way down their throat. Goes right in. It feels like you're kind of cramming something down their throat because you are, but they go right when you stick it down there, then they take a swallow and it's in. You don't have to worry about it. The only thing I did not mention in this whole protocol is amoxiclav or amoxicillin. It's another antibiotic, and I used that in Bradley's case because of his temperature, and I was trying to break that fever because there seemed to be maybe another bacteria infection going along somewhere in there, and that was why we added Clavamox to his protocol. So if you have a dog that has a fever, you can add amoxicillin, which you can also get right next to the metronidazole at your feed store. This is a pretty regular schedule when I have a dog with a really bad case. So if you want to take a screenshot of this, if this helps you. Fluids in Cerenia. Remember, Cerenia is your anti-nausea. Metronidazole, that's your antibiotic for their tummy. 9 a.m. Entice. Entice is your appetite stimulant. 10 a.m. food. I'm gonna syringe feed a little bit of food. And you see food on here a lot, but it's really tiny amounts. Noon, I'm gonna do fluids again. Start with fluids in the middle of the day. 3 p.m. doing this, syringe feeding, and I'm gonna mix a little bit of the probiotic. I'm only gonna do the probiotic once a day. I don't wanna overdo it for their system. 5 p.m. fluids again. 7 p.m. syringe feed food, 8 p.m. more metro twice a day, 9 p.m. syringe feed food, 10 p.m. fluids. I absolutely will be up in the night. I will stay up and do these kinds of things if I need to, but for right now, these are the things that have worked for me, and this is a pretty typical schedule. I'm gonna show you one more schedule. This actually came from a vet. This is a girl I grew up with, and she is a vet up in Oregon. This was the very first dog I ever had that she helped me with, and this was the schedule she gave me. And she, quite frankly, is the reason I was able to save that dog. So this, you're gonna see a couple things that I didn't mention. The loperamide, I don't even know if that's how you say that. That is an anti-diarrheal that you can get over the counter. Having done this, I haven't found the need for it, but absolutely, you can use that. Another thing you're gonna see that I didn't mention is the ondansetron. Ondansetron is another form of anti-nausea, similar to the Cerenia. It's just a supplement. So this is straight from a vet. I don't wanna link her if that's not something she wants, but her name is Jamie, and she helped me tremendously. Okay, last thing. Parvo is next to impossible to get rid of. It can live in the ground for up to 2 years. I just found out that hydrogen peroxide kills it. I haven't even looked into it. A vet tech just told me that. This product called Rescue, you can buy this off of Amazon. It is not inexpensive. If you don't have access to that, bleach. Bleach is what I've used for years. Now I can't say that bleach has actually killed anything, but I will tell you that it has greatly minimized the contamination. All I do is I mix it up in one of these weed sprayers, and I'll spray it in the areas where the dog has pottied outside or maybe they've puked. If the dog has vomited or had diarrhea on blankets, sometimes those are salvageable. If they are, I'll bleach them and wash them. If they're not, I toss it. I'll grab the Amazon links for some of these items that are available, and I'll link them either in the comments or in the description. I hope this video helped you. It's not a training video, but I'm a dog trainer. If you need help with that, I will link my $20 courses below as well.